Sinus family. Okay. So, in addition to working through RP and Q times 2 stat, when we're breaking down and measuring rhythms, there are a couple questions that we can ask ourselves when we're looking at rhythms to diagnose or call, not diagnose because nurses do not diagnose, but in order to identify rather the rhythm that you see. So you should always ask yourself, what is the story that this rhythm strip is trying to tell? Remember, this is the reason why we spent so much time on the cardiac cycle, because we really wanted to drive home the point that each one of these waveforms and intervals is telling a story. It's our job to figure out what that story is, okay? So some questions that we can ask ourselves when we first look at our rhythm strip. Number one, are there P waves? Okay, what do you think? In this example, are there P waves? Yes. I see 1, 2, 3, 4, 5, 6 of them, okay? The next question we can ask, do all the P waves look the same? Yes, in this example, there are P waves and they all are upright and they look similar to one another. This tells us that they should be coming from the same place in the atria. Is there one P wave for every QRS? The answer is yes. There are 6 P waves and there are 6 QRS complexes. What's the relationship between these P waves and the QRS complex? When I ask this question, what we're referring to is what is the PR interval, okay? The PR interval is constant for each one of these P waves and their respective QRS complexes, okay? So the PR interval is constant. So based on questions 1 through 4, which we've just asked, here's what we can tell about this strip. There are P waves present, they're all upright, and they look the same. That tells us they're coming from the same spot. The PR interval is constant for each P wave to the QRS complex that follows. That tells us that it's taking the same amount of time for that impulse to reach the ventricles from the atria, okay? Now, the last question we can ask ourselves, is the QRS complex narrow or is it wide, okay? In this example, we have a narrow QRS complex, okay? So that tells us, again, that the impulse must be originating from above the ventricles. Anytime you have a narrow QRS complex, the impulse is originating above the ventricles, okay? So, what's the interpretation for this rhythm strip, okay? This is sinus rhythm, okay, at a rate of 60, normal sinus rhythm. But what do you notice about these ST segments? Our QRS complex is here. Remember, the J point is the point at which the QRS complex begins to turn and head back to baseline. And then you see the big hump, which is representing our T wave. But this is where the ST segment falls. Notice how this ST segment is much higher than that PR segment that we're using as the isoelectric baseline. So, in this example, you would say we are looking at a normal sinus rhythm with ST elevation, okay? This would be something that you would see in somebody that's having what we refer to as a STEMI. We talked about that a little bit before, an ST elevation myocardial infarction. This is an absolute medical emergency. If you see this, assess your patient, report it right away, okay? Next up, let's go ahead and look.
Linda